Hello, my name is Lauren. I'm going to be your nurse practitioner today. I understand that you're coming in for left shoulder pain, and so we're going to go ahead and talk about doing a joint injection to help relieve that pain and increase your range of motion. So we will have to go over informed consent. I'll go over the risks and benefits of the procedure, and then you'll consent to the procedure if you feel that you agree with it. So the benefits of the procedure are to diminish pain and inflammation to that joint, as well as promoting joint function and range of motion. The risks of the procedure would be a tendon rupture, joint infection, post-injection flare-up from the steroid, injection into a blood vessel, tissue atrophy, an allergic reaction to the medication. It may not work, or we could have nerve injury, but all of these can be reduced with proper technique. So reasons that we wouldn't be able to do the procedure would be if you had a joint infection, cellulitis over the area, more than 3 injections in a 12-month period, if your joint was unstable, if you'd had surgery or prosthesis to that joint, fractures, and then other considerations that we'd have to go over would be if you had sickle cell anemia, coagulation disorders, or uncontrolled anticoagulation therapy, diabetes, or if your children or adolescent. So do you go ahead and consent to this procedure?
Yes, I do.
Okay, so can you please state which shoulder we're going to be doing the injection on today?
It will be my left shoulder.
Okay, so we're going to go ahead and do the anterior approach today, but first we're going to check your range of motion and make sure that you don't have any signs of infection or redness. So I'm looking over the shoulder joint and I don't see any redness, swelling, or any signs of infection that would contraindicate the procedure. So we're going to go ahead and do some range of motion. So we're going to do it both sides just to test. So if we could start with abduction, would be both sides going out, that would be abduction. And then adduction, and then flexion would be going up, and extension would be going back, and that's all good. We're going to test just overall shoulder mobility, and internal rotation would be going up like this, and then external rotation would be this motion here. And then we also need to check for your rotator cuff to make sure that's not injured. So we're going to do the joint test, or I'm sorry, the drop test. So what I would do is help hold your arm out, and then when I let go, go ahead and drop your arm slowly. And if you can do that without pain, then there's not going to be any signs of a rotator cuff injury. So did you experience pain with any of those?
Yeah, it was like
just to this region here.
Yeah, right there with all of them.
Okay. So
but just on my left side.
Just on the left side.
Yeah.
So we'll go ahead and do an injection to the site to hopefully help with joint function and to decrease your pain.
Okay.
So like I said, we're going to do the anterior approach. So we'll go ahead and get our materials ready here. So for this, we'll use 1% lidocaine without epi, and we will mix that with 20 to 40 milligrams of Solu-Medrol. So I would draw that up with an 18 gauge needle. First I would do the 1 milligram of epi. Of lidocaine without epi. And then we would do 20 to 40 milligrams of the Solu-Medrol. Then what we would do with our 18 gauge needle, then to get ready for the injection, we would go ahead and switch it to our 27 gauge needle. That's 1.5 inches long. Now we're ready for the injection after we mix it. Alright, so that's ready. Now I'm going to go ahead and palpate your shoulder here and identify my landmarks. So back here we have the chromium process right here. This is our humeral head right here. And then over here is our coracoid process, and this will be the landmark that we're using for this injection. We will go inferiorly and laterally to the coracoid process right in this joint space here. So we're going to have you externally rotate your arm so that you are opening up your joint space, And then we are ready for your injection. So we've marked our area. We're going to go right in here. So I'm going to get my gloves on. We're going to use clean gloves for this procedure. If we were taking a culture or aspirating the fluid, then we would go ahead and use a sterile technique. So for this one, we're going to use an alcohol pad, and we're going to just clean the site. And then we have our solution that's already pulled up in our 27 gauge 1.5 inch needle. We're going to go ahead and inject right where we had marked. Go ahead and inject.
Oh, and I see the green light.
Yep, so we know we're in the right place. We didn't hit resistance and we didn't hit bone, so we're going to go ahead and aspirate back. I didn't get any blood back, so we're going to slowly inject our fluid, our solution there. We're going to pull out the needle and then cover it with a Band-Aid. Now we're going to go ahead and talk about aftercare for you at home. So you're going to need to rest your joint for about 24 hours and remove the dressing or the bandage in about 24 hours as well. You're going to need to watch for signs and symptoms of infection such as redness, swelling, any drainage. If you're having fevers or increasing pain, you'll need to call us. And then there are signs and symptoms of steroid flare or post-injection pain. So if you over 36 hours after your injection, if you're having increasing pain, what you'll need to do is ice for 20 minutes for every 2 to 3 hours and take Motrin every 6 hours. If that doesn't seem to be helping, if you're not getting relief from that, you need to call us back. If we would have aspirated fluid today, if you would have had fluid recollection, you would also need to call the office back. And then if we sent cultures, they would be done in 48 to 72 hours. So let's talk about future injections and things like that. Okay, so then we can't do more than 3 injections in a 12-month period, so we'll keep that in mind. So you are set to go, but if you want to follow up with me in the office in the next few weeks, we can reassess the situation and how you're doing. And go ahead and give us a call if you have any concerns or problems in the meantime. Thank you.